Hello, I'm Dr. Moleski, and I'd like to welcome you to this video on cold laser decompression, where we're going to be addressing sciatica and other problems with discs in the low back. This is a non-surgical approach for back pain, leg pain, and low back problems. First, I want to tell you about a story about this gentleman named James. He played football for a local school here in Tallahassee called Florida State University. And unfortunately for him, he was injured playing, and he required back surgery. And he was had terrific pains in his legs at the time and had the back surgery done. Well, 20 years later, he's in town here, and he comes into my office, and the guy was, the leg bent, and he was in incredible pain. He says, "Doc, you got to help me." I said, you had his description, he came with MRIs and such. He says, "I'm not having surgery again. I do not want to have him cut me." He says, this guy's very active. Even, at the time I saw him, he was out working out, playing sports, and but his whole life was a shambles because he was in so much pain. And he had been this way for 4 weeks. And he had heard about our decompression approach to low back problems and sciatica. Well, we treated him on the machine with the lasers and such, and it was just phenomenal difference in him. I treated him on, maybe it must be 10, 12 years ago, and he's still fine. He didn't never seen for that problem. This system works very, very well, and it's a nice alternative to drugs and surgeries. One of the nice things about it, as he was telling me, is he says, "I don't want to have surgery because I don't want to get cut. I don't want to have the anesthesia. Don't have to worry about the infections. There's lots of things that are involved in surgeries," and he wanted to stay as whole as he could be. So let's tell you a little bit about me. I've been in practice for over 36 years. I've had years and years of experience with thousands of patients with back problems similar to yours. I am a graduate of the American Functional Neurology Institute. I'm board certified in integrative medicine, and I have a fellowship in applied spinal biomechanical engineering. Over the course of those years, I've attended thousands of hours of postgraduate education, treating back problems and whole body problems, just like what you have. So what are we going to cover here today? We're going to cover the signs of spinal disc problems. We're going to talk about what causes them. We're going to explain non-surgical spinal decompression and cold laser therapy. So first off, do you have a disc problem in your back? So many different things can occur. You can have numbness in your feet. You can have weakness in your legs. You can have back pain, tingling, burning, can't stand up straight, hurts to sneeze. Daily activities are impaired. It's just classic. And the really classic thing, you'll see people, they can't straighten that leg up, or they're hurting to get out of chairs. Typically, by this time you're feeling this way, you've had an MRI, and you know you have a disc problem in your back. So let's talk about the anatomy of disc injury. This is a modified Dallas discogram, and this shows a bird's eye view of a normal disc with the bones in the back. So you're facing that way, and we're looking down on your body here. What happens with a disc bulge is this area in the middle here is called the nucleus, and it's kind of like jelly in a jelly donut. This is the outside of the donut, and the jelly's in the middle. Well, if you squish that down or injure it, the jelly can squeeze out, and when it squeezes out, it causes this disc to bulge, and it'll be a disc bulge. As it bulges, it tears this cartilage tissue, which is what creates what's called an annular tear, and more of this jelly seeps out. Well, if it keeps tearing and rips out and it herniates, this is what's called a herniated disc. This nucleus actually bulges out beyond the outside of the donut. If it goes out really far like this, it's called a disc protrusion. That's bad. Now, this is fragmented disc. This is a bad situation. This is definitely surgical. If you have a disc fragment in there, they have to surgically take that out. It's like having sand in your eye. You got to get the sand out of there. It's going to keep irritating. So your problem could be anywhere along this. I have people come with tremendous pain that just have a disc bulge, or they have a disc protrusion. Everybody has a different level of threshold of pain. So now this is a side view of the spine. This is the front of the body, this is the back of the body, and here's that jelly donut. It's in green on this tissue, on this view. Spinal bone, and this is the cartilage. You get these annular tears in here, and this tissue starts to seep out, and again it starts to bulge it. So what do we do about that? We use something called cold laser decompression, and there's two technologies: non-surgical spinal decompression and cold laser or low laser therapy. So what is spinal decompression? Technically, it's called vertebral axial decompression. It's a very sophisticated kind of computerized traction. And it consists of this medical table where you lie on your back, you bend your knees, and we lay you on this table. And it's very comfortable. It doesn't cause any pain. We put cushions under your knees, and we put harnesses on you. And one harness will go across the top of you and one across your hips. And the one across the hips is connected to the table. And so it attaches to the table, which is attached to the computer. And this computer will start to draw down on your hips, and it will actually open up. And the idea is to open up the disc space in your back. So it's different than old-time traction. If you are ever familiar with old-time traction, people would talk about how much it hurt. Well, that's because they would just pull you, and your body doesn't really want to be pulled apart. But with spinal decompression, this machine reads you like 17 times a second. And if the computer senses you tightening up, it lets go. And then when you let go, it'll pull a little bit more. So it kind of fools your body into creating lots of negative pressure in there. And the idea is to get upward to a negative 150 pounds of pressure so that it actually will pull and create a negative vacuum and suck that tissue back down. That's the concept behind spinal decompression. And again, we're talking about how it separates the bones, and I already discussed that with you. This is a picture of the table. This is the head of the table. Your feet would be down here, and this is the computer that does all the work. So I'm going to show you a animation of what we're talking about here with sciatica. This is a sciatic nerve coming off the back, and this is a bone here, and you're seeing the sciatic nerve inflamed and irritated. It goes all the way down the leg to the foot. People have pain on the front of their side of their leg, front, back, middle parts. It depends what part of the nerve is affected. And so that nerve gets angry, and it's a big nerve. The women tell me they'd rather have childbirth than have sciatic pain. So here's a side view here, and this is where this nerve comes off the low back. So here's the sciatic nerve. It's a bone. There's a disc that's prolapsed down and bulged. And the idea is to get that off of there. And this nerve is irritated, going all the way down, just pulsing all the way down to the foot. Some people just have pain in their knee or their ankle or their calf. So again, I already talked to you about the procedure, how this works. The science behind it is to create that negative pressure, and it's important to get enough pressure that it actually does the job and relieves you. What's nice is that you can get relief quite quickly. And the idea of this therapy, by the way, is once you're done, you're done. It's not the type of thing where you have to keep doing it forever, every month for the next 7 years or 20 years. The idea is to decompress it and fix it to where you're out golfing and doing what you want to do. Research suggests that it can draw this material back in. This is an MRI that shows you a normal disc, vertebral body, and this, you can see the bulge of disc sticking out here. This is a herniated disc right here. You can tell it hurts just to look at it. People ask me, well, what keeps it in there? Well, it's very difficult. It takes a lot of pressure to draw that back down. And once you draw it back down, the body, a lot of experts think that the body makes these fibroblasts that actually plug up that hole, and your body will heal it over. That's another one of the reasons why we put lasers on this, because lasers also promote tissue healing. Here it is. This shows a picture of the granular plug. The idea is pulling this back and then let this plug up that fracture and that tearing of that annulus. Again, this is the bone and the disc. So the question is, does it work? Bottom line is yes. We get tremendous results with this. If we look at you and we determine that you're a good candidate for this, the odds are tremendous. I mean, 9 out of 10 people do just tremendously well with this type of therapy. No side effects to it. It can only help you. There's a tremendous amount of research being done about this now, and they've actually found out that the decompressive force itself actually stimulates the cartilage cells in the discs to regrow. So it's possible for your back to be better 2 or 3 years from now than it is today, and actually improved and actually healing itself. Now I want to talk about cold laser therapy. Cold laser therapy is an amazing therapy. It was discovered and worked with a lot in Europe, and they've used it for the past 50 years, and it's only been approved in the United States by the FDA since 2002. So most people have never heard of cold laser therapy, but it's a tremendous therapy. No side effects to it, and it just works great. What they found is that there's certain frequencies that will address ligament, muscle, tendon, bone, disc. I mean, there's a frequency for everything. The key thing was the wavelength. The wavelength they found is a certain wavelength that the body normally functions at. And so when you hit the body tissue with this wavelength, it kind of turns that cell back on and puts energy back into the cell to where it starts churning out ATP and proteins and heals itself. And again, they have research out now that shows that applying cold laser will actually cause cartilage cells to regrow. And that's really fixing the problem. It's really exciting. By the way, when they first found cold laser therapy, they thought they were looking for an answer to cancer. And so they were doing experiments on lab rats, and what they would do is they would do an incision, and they put the cancer cells on the rat, and then they would use lasers on it. And what they found was that it didn't do anything for the cancer, but the incision site healed 2 to 3 times faster on the lasered group than the non-lasered group. And that's what made them realize that, oh, wow, this actually promotes healing, not necessarily kills off cells. And by the way, hot lasers, which you're familiar with, they do kill off cells. That's what they use in surgeries, like eye surgeries, where they'll go in there and they'll actually vaporize the cells. Well, these lasers are a laser, but not high intensity, and they actually cause cells to heal and regrow. And again, the literature, and I'll show you a list at the end of them showing that lasers will accelerate cell growth, stimulate wound healing, increase metabolic activity of the cell, nerve activity of the cell. It will reduce fibrous tissue formation. It's just a grand therapy. So don't underestimate the power of cold laser decompression. And your body can heal itself. Your body is an amazing creation that can heal itself. And if we can stay away from surgeries and medications as much as possible and be in this body that was created for you, I mean, you're better off that way and dealing with it that way. That being said, there's 3 common questions we get. How long does it take to get better? Research shows you that it takes 10 to 20 decompression treatments to correct a problem. And we do that over the course of about 6 to 8 weeks. Each treatment when you come in lasts about an hour. And so there's a lot being done to you there. You're on the table for half an hour. We use other therapies on you, the lasers, and we use interferential current therapy on you, cryotherapies, and then you get on a massage table at the end of the treatment. So you're here for an hour, so there's a lot that takes place. But we're very punctual. When we schedule you at 10 o'clock, we're going to see you by 10:05. You don't sit here waiting for 2 hours for me to see me and then get your treatment going. We like to be very, very punctual. I hate going to an office where you wait forever. Other question, does insurance cover this type of care? The simple answer to that is no, and that frustrates lots of people. And it frustrates me too, because I've been dealing with this for years and years and years, and insurance considers this alternative elective care. And does that make me angry? No, angry is not the word, but disappointed, because I pay lots of money for my insurance, and it seems like my insurance never pays for the kind of care I want. They'll pay for usual and customary. Well, I don't want usual and customary. I don't want to drug and just treat my symptoms. I don't want to get cut and have surgery if I don't have to. I want the care I want to have. And if you want the care you want to have, you got to pay for it. That's just the way it is. It's unfortunate, but that's the system, and it's not getting any better. Taking that into consideration, cold laser decompression is a heck of a lot less expensive than drugs or surgery, and even the copay for a surgery. I had a lady come in my office, her name was Andrea, years ago, and she was a mother of 3, and she came in my office and she was just in tears. She had had spinal injections. They wanted to do surgery on her back. She couldn't function. She's in bed all day. She could barely move. She said, gee, I can't take care of my kids. I can't take care of my husband. She was at her wit's end. So we went through all of her data and everything, and she looked like a good candidate for this. Well, long story short, we got her on the table and lasered her and such, and it's just unbelievable the difference in this woman. Today, she is out doing what she wants, a whole new person. And that's what we like. We like to see success stories. That's why we only take patients that we know we can help. We want to change your life for the better, and that's why we come in the office every day, to add value to your life. So what's next? Call for a consultation. You're not going to know whether we can help you unless you come for a consultation. During this consultation, you'll have, 2 visits. The first visit, you'll come in and we'll discuss what's going on with you, your history. We're going to review any x-rays, MRIs, blood tests that you've had. We're going to review your intake forms. And looking at that, we can say, there's no contraindications to doing this therapy with you. We'd recommend having a complete functional neurological exam. Once you're done with that, we'd have you come back in again, probably a day or so later, and at that point in time, I'll be able to tell you whether I'm going to accept your case. If we accept your case, we'll tell you so. If we don't think we can help you, we'll tell you so. If we accept your case, we're going to go over all the findings we found in the exam, all your paperwork, everything. We're going to review the treatment plan and all the financial obligations on your part. At that point in time, we can begin care, or if whatever you decide you want to do. So you'll know all costs involved at that point before you start anything. So I encourage you to call, get it for a consultation. You won't know whether we can help you unless you come in for a consultation. Well, I hope you've gotten something out of this. I enjoyed talking with you and look forward to seeing you soon. You have a great day. Thank you.